From the food on your plate to the numbers on your scale, uncover how your weight directly impacts your risk of diabetes. Welcome to my channel, Diabetes Fam. Diabetes Fam is your go-to YouTube channel for empowering insights on diabetes prevention, management, and the latest research. We're here to educate and inspire healthier living. Subscribe to our channel for supportive resources and inspiration. Today, we're diving deep into a topic that affects millions worldwide: how our weight influences our blood sugar levels and the intertwined relationship between obesity and diabetes. This connection, often overlooked, is crucial for anyone striving for better health and diabetes management. Let's unravel the complexities of how maintaining a healthy weight can be your strongest ally in controlling high blood sugar levels. Before we do, let us talk about these two conditions first. Obesity, a significant health concern worldwide, is characterized by excessive body fat, posing risks to overall health. It's primarily measured by body mass index, BMI. Although BMI's limitations necessitate additional metrics like body fat percentage and waist-to-hip ratio to assess obesity-related health risks fully. The global obesity epidemic affects both developed and developing countries, driven by shifts in diet, reduced physical activity, and socioeconomic changes. This rise in obesity rates leads to increased non-communicable diseases, healthcare costs, and reduced life expectancy. Public health efforts target obesity with educational programs, policy changes, and community interventions to encourage healthier living. Tackling obesity effectively requires a comprehensive strategy that addresses genetic, environmental, psychological, and social factors, aiming to curb its growth and mitigate its health implications. The urgent need for global action is clear as obesity continues to impact health outcomes and healthcare systems worldwide. Diabetes is a chronic health condition characterized by elevated levels of blood sugar, glucose, which can lead to severe health complications if not managed effectively. It primarily manifests in two forms: type 1 and type 2 diabetes. Type 1 diabetes, often diagnosed in children and young adults, is an autoimmune condition where the body's immune system attacks insulin-producing cells in the pancreas, leading to insulin deficiency. Type 2 diabetes, more common, occurs when the body becomes resistant to insulin, or the pancreas fails to produce enough insulin, often related to genetic and lifestyle factors, including obesity. Insulin, a hormone produced by the pancreas, plays a crucial role in regulating blood sugar levels by facilitating glucose uptake into cells for energy. The prevalence of diabetes is increasing globally, posing significant health risks such as heart disease, stroke, kidney failure, vision loss, and nerve damage. Its impact on individual health, healthcare systems, and economies underscores the importance of effective management and prevention strategies to mitigate its rise and ensure those affected can lead healthy, productive lives. Now, the link between obesity and type 2 diabetes is well documented and critically important to understand in addressing the global diabetes epidemic. Excessive body weight, particularly visceral fat around the abdomen, plays a pivotal role in developing insulin resistance. Visceral fat is not merely a storage depot for excess calories, but an active endocrine organ that secretes hormones and pro-inflammatory substances. These substances can impair the function of insulin, the hormone responsible for regulating blood glucose levels, leading to insulin resistance. As insulin resistance intensifies, the pancreas compensates by producing more insulin until it can no longer keep up, resulting in elevated blood sugar levels, a hallmark of type 2 diabetes. Statistical data reveal a strong correlation between obesity and an increased risk of developing type 2 diabetes. For example, individuals with obesity are at a substantially higher risk compared to those with a healthy weight. Understanding this connection underscores the importance of managing body weight through lifestyle interventions as a primary strategy for preventing or delaying the onset of type 2 diabetes, highlighting a critical avenue for public health efforts to combat these interlinked conditions. The physiological mechanisms through which obesity contributes to elevated blood sugar levels and the development of type 2 diabetes are intricate and multifaceted. One primary mechanism is insulin resistance, where the body's cells become less responsive to insulin, preventing glucose from entering cells efficiently. This resistance prompts the pancreas to produce more insulin to overcome the deficiency, leading to high insulin levels and eventually pancreatic exhaustion. Obesity particularly the accumulation of visceral fat around the abdomen, is closely linked to the development of insulin resistance. Visceral fat releases pro-inflammatory cytokines and other substances that impair insulin action in cells. This state of chronic inflammation not only contributes to insulin resistance, but also to the dysfunction of pancreatic beta cells, which are responsible for insulin production. Additionally, obesity influences the balance of hormones and substances involved in metabolism, such as adipokines, which can further disrupt insulin sensitivity and glucose homeostasis. This hormonal imbalance, combined with the direct impact of excess fat on insulin signaling pathways, significantly impairs the body's ability to regulate blood sugar effectively, setting the stage for the development of type 2 diabetes. Effective body weight management is a cornerstone in controlling blood sugar levels and mitigating the risk or progression of type 2 diabetes. A balanced diet rich in whole foods, such as fruits, vegetables, lean proteins, and whole grains, can significantly impact blood sugar management. Low-carbohydrate diets and high-fiber foods are particularly beneficial, as they help reduce blood glucose spikes after meals. Physical activity is another critical element in weight and blood sugar management. Regular exercise, including aerobic and resistance training, enhances insulin sensitivity, meaning the body can use insulin more efficiently to lower blood glucose levels. Furthermore, exercise aids in weight loss and maintaining a healthy weight. Behavioral modifications, including stress management and ensuring adequate sleep, are vital in managing diabetes. Chronic stress and lack of sleep can negatively affect blood sugar levels and insulin sensitivity. Incorporating stress-reducing practices and prioritizing sleep can improve overall metabolic health. Lastly, the role of mental health cannot be overlooked. Support from healthcare professionals, including nutritionists, psychologists, and exercise specialists, is invaluable in creating a sustainable plan for long-term health. Together, these strategies form a comprehensive approach to reducing the risk or severity of diabetes through weight management and lifestyle changes. Medical interventions for managing obesity and diabetes encompass a range of therapies designed to control weight, improve insulin sensitivity, and maintain blood sugar levels within a healthy range. Medications for diabetes, such as metformin, are pivotal in enhancing insulin sensitivity and reducing glucose production by the liver. For those with type 2 diabetes, newer classes of drugs, including SGLT2 inhibitors and GLP-1 receptor agonists, not only aid in blood sugar regulation, but also promote weight loss and protect against heart and kidney diseases. Insulin therapy remains a cornerstone for type 1 diabetes management and is also employed in later stages of type 2 diabetes when other medications are insufficient. Bariatric surgery is another significant intervention, particularly for individuals with obesity and diabetes who have not achieved the desired results through lifestyle changes and medication. This surgery can lead to substantial weight loss and dramatic improvements in blood sugar levels, sometimes resulting in diabetes remission. The role of healthcare providers is crucial in navigating these options. They tailor treatments to individual patient needs, considering factors like the severity of obesity, blood sugar levels, and other health conditions. Regular monitoring and adjustments ensure optimal management of obesity and diabetes, highlighting the importance of a collaborative approach between patients and healthcare teams. Overall, the intricate relationship between obesity and diabetes underscores the critical importance of managing body weight to control blood sugar levels and prevent the onset of type 2 diabetes. The evidence presented in this article highlights how excessive body weight, particularly visceral fat, contributes to insulin resistance, inflammation, and hormonal imbalances that impair the body's ability to regulate glucose. Addressing obesity through dietary changes, increased physical activity, and behavioral modifications is essential for reducing the risk of developing diabetes and mitigating its health impacts. Moreover, the role of medical interventions, including medications, insulin therapy, and surgical options, remains pivotal in the comprehensive management of these conditions. However, the effectiveness of these treatments is significantly enhanced when combined with lifestyle modifications, encouraging a proactive approach to health, emphasizing the importance of regularly monitoring weight and blood sugar levels, and seeking healthcare professionals' guidance can empower individuals to take control of their health. By adopting healthier lifestyle choices, individuals can significantly reduce their risk of obesity and diabetes, improving their quality of life and longer, healthier lives.